Good evening, everybody. How you doing out there? Hope everybody's having a wonderful and blessed evening. Welcome on in to Medical Talk in Layman's Terms with Nurse Charlene. And tonight, the topic is going to be signs and symptoms, a part two to last week's Your Body is a Snitch, Believe It. So I'm just going to finish up what I didn't add on to that last podcast and everything. And also, the topic will be additional, so it'll be a two-part, and that will be the caregiver role and the effects on the caregiver's mental health, not the patients, the caregivers. Okay, so y'all welcome on in and stuff, and stop what you're doing for a little while and stuff, and tune in for a bit and everything. If you're unable to, um, if you're, oh gosh, I'm getting a call. Get on and stuff. But if you're able to, then get on here, get you a little nugget or two, and then if you're not able to get on and everything at this time because of other engagements, go ahead and watch the replay. And I'm coming on Facebook Live, of course, and also YouTube. So my YouTubers, let's get those subscriptions up. Subscribe, like, tag, and share on Facebook and everything and stuff. I'm ready to go and everything. So again, this medical talk in layman's terms with Nurse Charlene, and the topic is signs and symptoms, part two of a two-part series where I was talking about signs and symptoms last week, but the topic was your body's a snitch, believe it. And then also it's a second part to this one, which is the caregiver role, effects on mental health, and things such as and stuff. So watch what I'll do. It's a little cutting edge and stuff. It's gonna get down. But before I can do that, you guys, I have to read my podcast disclaimer. Yeah, see, I said that without stuttering. Okay, and stuff. So it goes as follows before we get started. The purpose, okay, the purpose of this podcast is the podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. Okay. If you have questions about a medical condition, reach out to a qualified healthcare physician, a professional, which is your physician. Okay. Or what they call it, primary care, whatever you hear it as. That's the person because they got your information. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast, including this one. Hold on. I got you, baby. And so guest views are their own and may not reflect the views of the host or this podcast. I'm the host and this is my podcast and everything. And most guest views are going to reflect something that I feel passionate about or something. So rest assured in that. The information shared is for general knowledge. It should not be used for any legal or medical purposes, meaning I can't help you win your lawsuit. But if you're doing the right thing, I hope you win. How about that? I'm on your side. Okay. Also, consult with a licensed professional who knows your medical history for a meaningful evaluation, meaning they need to know your history. They got to know something about you. Not, I just got a headache, but you didn't tell us all the other things and stuff. They need to know something. And the more you give them, the more they can help. Stay informed, of course, but always seek professional medical advice when it comes to your health. All right. So I want to make sure because I say it to myself also, and then sometimes I'm starting to ad lib a little bit and stuff because it's very important and it's telling you everything you need to know about the situation and everything. So putting a couple people on, so excuse me here, Britt. It's my daughter and stuff. I'm giving that to your granny. Come over here, babe, and give me your phone. You could at least be on Facebook though. I'm on live, baby, and stuff. So I'm probably not gonna get you on now. Let's see. Yep.
Hey, you guys.
Oh, nice. Beautiful. Get your phone. The devil is a lie. Okay. Oh, that is too cute. Go find it yourself, okay, babe? Yes. Look at you. You gonna stand right there? Yes. Brittany. Okay, I'm gonna sit down. Okay. Lord Jesus. Okay. So get into the subject. This is called real life, and I am on live. All right, y'all. Let me see. Why is it not giving me no comments right now? Oh, okay. Hello. Hi, Miss Kathy. Welcome on in to Medical Talk in Layman's Terms with Nurse Charlene and stuff. Glad to see you on, and everybody else come on in. I see Auntie Josie. Come on in, sweetie. Definitely. You checking in. Hello, everyone. Hello, Auntie Josie. Everybody say hello, Auntie Josie. No, I'm just kidding with you and stuff. So, yes, we're going to go ahead and let's get started. We're going to start off with signs and symptoms because this is very important and it's kind of like a stair step. That's why I called it part two up there. In my little board, I didn't do a lot of writing, but look at that wheelchair. I know y'all see that wheelchair right there. Oh, boom, a wheelchair. I just put it up there because I'll be liking to draw. I feel it. I feel my inner Picasso. This is supposed to be a bed. It'll get better with time and more drawings. And then that's supposed to be a walker. I don't know what I was doing, but I was trying to make it where you can kind of make it out. Of course, the EKG. That's the heart of healing, and it's another heart of healing up here and stuff. And then it's for the part two, which is caregiver role and the effects on mental health and the caregiving and stuff. That's where this comes in with nurse, doctor, family, caregiver, chaplain or pastor or pastoral care, prayer warriors, and everything. These are all part of when you have that person that goes down and they get sick and everything. All these people play a role. Case managers and social workers and stuff. Another EKG. I just put something there and stuff. And this is the famous or infamous one and stuff. Some people will recognize it, like any of my nurse crew that's on and stuff like that. But for anybody else that may have been in the hospital at one time or another, because we all have, okay, and stuff. That is like that little white, it's called the whiteboard or the drawing board, dry erase board in a room, and it has your name, Jane Doe or James Doe, whatever you want to go with. And then it might have the date, today's date, and then it has the nurse Jackie. I just came up with that and stuff. Then it has the CNA or certified nurse's assistant or the nurse's assistant, which is Tom. It's gonna be Tom this time. I don't know, Uncle Tom, whatever you want to call them, and stuff. And then also it has a plan of care. Oh, they're gonna get an EKG or a CT scan. It doesn't matter what these are. I'm just naming them off. X-ray, and then it might have discharge plan of care. Discharge home or discharge to a skilled nursing facility. But you see what I'm saying. And then PT, OT, nobody knows what those are. Physical therapist is PT, occupational therapist is OT, and a RN, which is your nurse and everything and stuff. So different things. But that was made to be like a little board where they be writing their name and all that little scribble scrabble. They're supposed to actually explain that to you and stuff. I'm medically inclined, so of course I know what all the stuff says and why it says it on there because I had to write it on the board for my patients. So as I digress, that's where all of that comes in and stuff. Remember, this is interactive, so I get real pumped up once I start seeing my folks come on and everything. And your no comment is just too little. Like, I be hurt, It's okay. Well, let's talk about you be hurt, and stuff like that. So it's not a thing where you have to worry about oh, if I say this, they gonna be laughing. Nobody laughs, and there's no judgment. And I hope anybody out there, if anything, they're gonna help you, because there's other nurses on. There's other nurses watching, even if they don't say anything. Oh yes, yes. Kathy said on my whiteboard, I forgot to put it. It was supposed to go right here, where it's a little empty space. Pain level. Have you ever heard when you go into the doctor or something like that, and they say, you having pain and stuff on a scale of 0 to 10, what's your pain level? 0 being no pain at all, and 10 being, oh, it's turned up. I need something. When you gonna give it to me? And everything and stuff. Welcome in, Brittany. Yes, welcome in, everybody. As I see you come on and stuff, definitely it does pump me up, and it does get me out of that little hi everybody, and stuff like that. Then you're gonna get the real Charlene, and everything. So come on in and stuff. We're gonna do this thing. So I'm gonna birth this one, like a good friend of mine was saying before. Sometimes you gotta birth some things, and so I've been sitting on this and stuff. But I'm gonna definitely give this out to you and everything, and that's part 2, which is the signs and symptoms. So I'm gonna tell you why it says signs and symptoms, because what is that? What is it, like Capricorn? Signs and symptoms. What is that and stuff? Well, I'm gonna tell you. How about this? Signs is a objective view, or a person's judgment, or how they feel about the situation of a disease observed by others and stuff. What the person judgment of the situation is. That's a sign. And examples of a sign is a rash, a fever, abnormal vital signs. My blood pressure is real high, so that means something going on inside of me and stuff. Or my blood pressure real low, that means something going on inside of me, and different things like that. A fever, I'm hot, I don't know why, what's going on, and stuff like that. A rash, that's the raised bumps on there. It might be a patch, it might be all red in that area. It might be itchy, and stuff, different things and stuff. It depends on what it is and where did it come from. Sometimes you got to be your best investigator. Was I in the forest? Was I rolling around in the grass at the park? What was happening, to elicit that? So symptoms is subjective. That means a personal feeling. That means my own personal feeling of what I feel like I have, and everything. Um, or as reported by the patient. I'm the patient, I go into the ER, I got nausea and vomiting, I feel sick to my stomach, or something like that. That's what that is and stuff. So it means your pain on the scale of 0 to 10, 10 being the worst pain ever, and 0 being no pain and stuff. What are you? I'm a 8.5. You can add a little fancy to it. It's a 8, and stuff. You don't have to say 8.5. You could just say 9 then, or something, or say 10 and get something happening super fast after they check your blood pressure and everything. Because what if you're a 10 and your blood pressure is all the way bottomed out? That means you probably dehydrated too and stuff, but all you know is your pain and stuff. But they got to look at the other stuff before they give you the wrong thing and you pass on out and pass away, and everything. Yes, Brittany, what you said, you, what's that mean? I'm gonna get you, girl, and stuff. But also, why does it matter? Signs and symptoms. The reason why it matters is it helps separate the difference between what happens to you and how you get diagnosed. Like you might have this, and this, and it might have been food poisoning, or you might have these 3 signs and symptoms, and it might be actual COVID. It might be the flu, stomach flu, even, those both get you nausea, but one is more definitive than the other one. Like this one is because I ate at this new restaurant and the food probably wasn't that good, and you had a reaction, and now you can't keep anything down, and you just been nonstop throwing up. That's a 911 call, and stuff. You need to go to the hospital and stuff. Whereas another one might be, I caught something from the kid came home sick and they were throwing up and stuff, and then I'm wiping them up and not washing my hands properly, and now I got it. I done put something in my mouth and didn't wash my hands properly. Now I got the same thing as the kid, and stuff. Then that's the stomach flu or something like that. So, it's different ways of them diagnosing it. That's why they ask you so many questions, if that makes sense. Also, another example of signs and symptoms so that you know what I mean by objective and subjective. They said signs are objective, where symptoms are subjective. Signs are or getting a gauge or judge a person's judgment, whereas symptoms is a person's feelings about the situation. So I'm going to give you a couple of examples so that you know what that is, and stuff, so that we can break it down into layman's terms and everything. That would be a sign would be high blood pressure. That's a sign, a judgment. A headache would be a symptom. My blood pressure is too high, and everything. So the high blood pressure is too high. So therefore, a symptom will be getting a headache from it. And that's a hallmark sign, because usually you get a headache when you get stressed out and different things like that. So if you see where I'm going with it. So a sign is swollen joints, a judgment and stuff. A symptom is subjective, that's your feeling, and that will be joint pain. So it's swollen, but you feel the pain. That's a symptom. The sign is that it's swollen. So that means it's inflamed. That means inflammation means pain and stuff. So if that makes sense. So then, okay, say you have a fever and it's measured as a fever. I'm 101.5. That is a true hallmark fever. So that is a sign. I'm 101.5, which is a fever and stuff. A symptom of it is feeling hot. So hot till you're cold. You might get chills because you're so hot. And it might be 102 or 103 or something like that, closer to 103 and stuff. So the symptom is being closer to 103. That's the feeling. I'm hot, I'm cold, or whatever and stuff. So that's where that makes sense. Welcome in, Mike Jefferson Jr. and everything. So then a sign would be a cough and stuff. That's a sign, objective. That's your feeling. It's a cough. I got a cough, and everything. A symptom of the cough is chest tightness. That means I got a cough, but it's from something. So it might be from getting the flu, getting pneumonia or something like that. So you're nonstop coughing, getting a bronchospasm, which is the lung spasm, which is kind of like having an asthma attack, a freaky asthma attack and everything and stuff. So that's where it comes in. The symptom is the chest tightness. The actual sign is the cough, followed by the chest tightness, which makes you indicate I'm telling on it, and everything. So you see where that comes in. So I wanted to do, I'm a see and stuff. I'll do a couple of these facts versus myths. And so there's a myth, and I'm saying that first. This is something that's untruth and stuff. And so one of them is, if I don't feel sick, I'm healthy. I don't feel sick, so I'm healthy. Why should I, okay. That's what I'm saying. That's untrue. That's the untruth. Fact is, some conditions like high blood pressure are silent. So they gotta tug at you. They gotta get their little teammates to come attack you, so that you understand that you're coming down with some high blood pressure. It could be borderline, or you could catch it late and keep ignoring it, and then it turn into straight up high blood pressure, and you need to be placed on some pills. Or you could continue to ignore it, and then it could turn into a heart attack or a stroke, or it can go ahead and send you on to your maker, and stuff. So it's up to you where you want to catch it at. It's there because it's going to tug at you, and then it's going to jump you. It's going to say, hey, 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 and so you better, when they say hey, if you don't catch hey, and hey, nice and low, you better catch hey, because it's coming. and stuff. So you see how it's so simple, but it will tell on you and stuff. But I'm gonna tell you some other hard-headed things in a minute. So another myth, meaning a untruth. Symptoms must be severe to matter. If they ain't turned up and stuff, it don't even matter. Just ignore it. Just take something for it and go on about your business. Yeah. So then the truth, that was fake. Symptoms must be severe in order for them to even matter anyway. No. They were whispering. When they start yelling, it's already past too late, half past too late and stuff. So that will be mild or vague symptoms can signal serious issues. Because remember, a heart attack is it's a silent killer. So a heart attack can kill you. So it doesn't present like a heart attack, like, oh, you think your heart's supposed to be like, oh, I'm in pain. I'm gonna jump out your chest. You're gonna see the whole left side of you jumping and stuff. No, it's silent, but it'll do other things like tighten up those jaws, oh, or something like that. You might feel nauseous. You might all feel like impending doom, like somebody sitting on your chest. Your chest gets so tight, you can barely pull in your breaths and everything. If you don't tell on that animal, I'm just saying. So then, what is it? Another myth, because these are good. I like these examples and stuff. A myth would be something like signs are more important than symptoms. Now they really being messy. Signs are more important than symptoms. And so we just talked about signs and symptoms and everything and stuff like that. And so then the truth, that was the untruth. Signs aren't more important. They're both important. You see what I'm saying? And you see the title, signs and symptoms. That's why they're important, because they both count and everything. And so the truth would be both are critical and often interdependent, because you get the sign, like I was telling you let me just go back to it. The sign is high blood pressure. The symptom is a headache. You see what I'm saying? But if you don't get the headache, you're only getting the sign. If you get the headache and you don't get the sign that you got high blood pressure, you don't know, then you get the other part. Oh, thank you. Rosie Granny Allen is watching, and she said, in Jesus' name, teach, Nurse Charlene, teach. Amen. I'm going to do my best. All right. And so another one, this is a good one. It's a myth. So I want to make no mistake, I'm saying the myth is ignoring symptoms is okay if they pass. If they go away and stuff, then so what? Who cares? And okay. So the truth, that's absolutely not true and stuff. The truth is temporary relief will hide a chronic symptom. So if I'm always don't have an appetite, my stomach is always hurting and stuff, and then I'll take a little medicine for this and I'll take a little medicine for that, and the symptoms kind of go away and stuff. Did I heal it? Did Pepto-Bismol heal it? If I got diarrhea, I got the runs, I just keep going. I can't stay off the toilet and stuff. If I take Pepto-Bismol and it slows it down, did I heal it? Or did I make myself comfortable because now I'm not going to the bathroom every 2 to 3 minutes? You see what I'm saying? So that's what it's called. What I do often to myself and my loved ones is, because I'm medically inclined. Unfortunately and unfortunately, I masked it, and stuff. And it was by accident. It wasn't a malicious thing. And a lot of us do that. Even in the hospital, when I had patients, I had a habit of, oh, they gonna need some pain medicine, so and so. So I come in and ask them, they might not even be thinking about it at the time, but I don't want to be hey, you didn't come in, or something like that. So I go in here, are you in pain? Scale 0 to 10. What is it? Okay, it ain't none. Okay. Did you want your pain medicine when you do get up to a certain amount, and stuff? Because I didn't want to hear that sometimes, because I'm busy charting or something like that. I didn't want to get caught up or something like that. But at the same time, that's what it's there for. If you have pain medicine is supposed to actually go to the pain receptor, not make you a drug addict or dope fiend or whatever and stuff. It's supposed to go to the pain. And usually, this is the good part about it. If you're actually in true pain and you're prescribed a pain medicine, it actually goes to the pain. It doesn't go get you high. Now, after that, if you're in no pain and you take that same medicine that you take for pain, okay, I'm gonna leave it at that. I'll let you be the judge on that. Okay. So why does early detection matter? Early recognition equals a better outcome, because a later recognition could be the difference between stage 1 cancer and stage 4 cancer, where you might have to hang it up, and stuff like that. So it's literally a difference between that, and stuff, by just ignoring something that's happening. It doesn't matter if you got back pain all the time. You're going to ignore it until you're crippled and you're in a wheelchair for the rest of your ending of your life, or something like that, because you never addressed it in the beginning, and stuff like that. So this is where it comes in. Hello, Michelle. Welcome on in. Come on in and stuff. And the water's fine, like somebody said before and stuff. So come on in. Feel free to ask a question or whatever you need to do and stuff, or just listen on up and stuff, because I'm trying to talk some good medicine to us, all of us, including me. Yes, and stuff. So the other thing I wanted to go into was other things and why it matters. If you tell on it early, you can prevent the progression of things like diabetes. Everybody is pre-diabetic. Oh my goodness, they said I got pre-diabetes. They telling you that you diabetical, and you diabetes-ish, and stuff. And almost all of us, because they're so strict with the numbers and stuff, that almost all of us are kind of pre-diabetic. We just by default, by accident, by Cheetos, by honey buns, by Snickers, and stuff like that. So we're already automatically kind of predisposed to it. It just depends on if your pancreas is not pancreasing, and stuff, which makes your insulin in your body to control glucose and stuff. Then guess what? That means that it's slowing down somehow, or you putting too much in and it's overwhelmed, so it's not properly bringing those blood sugars under control. And if them blood sugars get out of control, it starts doing things and it starts going places in your body, because remember, it rides inside the blood and stuff because it's an energy. So sugar is not always bad. It gives you energy so that your muscles function, that your eyes blink, that your muscles flex, that you move one foot in front of the other, and so on and so forth. So it's important that you have them, but at the same time, if you ignore it and stuff, that pre-diabetes does convert into diabetes. Welcome to diabetes. But that pre-diabetes and stuff can also, with a little bit of lifestyle changes, you've been told, you've been warned. Now you watching that A1C and it's 6.0, and then it's 6.2, and then it's 6.4, then it's 6.6, and so on. Then you get you a 7 or a 9 or 10, and stuff. It go up to like 14 or even above that and stuff, but 14, you don't even want to mess with that and everything and stuff. Welcome on in, Pastor Mayfield. Thank you. She said, this is great information. Yes, thank you and stuff. But this is what you want to do. You're pre-diabetic. You could go back the other way and become non-diabetic. It took a little while. It took a little sacrifices, and some things I still haven't gotten rid of. But if you put one foot in front of the other and try, you can do it too. It was your diagnosis. If it's not, congratulations. Don't go forward into pre-diabetes and don't go forward into diabetes. So this is no judgment. Like I said, it's just recognizing and why you should tell on your body. It's telling on you. That's why your blood tests come out with what they say. That's why when you take your blood pressure and it come out high, yeah, well, it was low once upon a time. Now it is, so welcome on in. All right. And stuff. Other things that early detection matters. It enables a timely intervention and reduces the complications. So before you get to that part, say you got this or you got that, whatever the diagnosis is, and stuff. And then if you told early enough, you could start doing things to change it and to kind of reverse it or to lower it. Like you don't have to always have high blood pressure. You can have controlled blood pressure. How about that? There's nothing wrong with that. You told on it. And so you got to do what you got to do to get it back down to the good side, and stuff. And that actually happens. Diabetes. Okay, you all the way up. You could come down. Like it took you a minute to get up there. It take you a minute to get down. But if you keep working at it, you can come down. And then some people even became non-detectable. They still check their blood sugars every day because they can convert and go back up. But it can happen. So it's not the end of the world if you put yourself in the know. That's why I'm here. Because I said, help me, help you, help yourself and your loved ones. Recognize granny's stuff. Recognize grandpa's stuff. Recognize mom or dad, sister or brother, children, and everything and stuff. Check into it. See what they're doing. Did they have, when they last had their checkups and stuff like that? Sometimes they need their coattail, not even pulled, but hey, I love you. Sure, won't you here with me? You want me here with you, right? So I need to get my checkup. You got to get yours too. Young and tender is not the answer anymore. We all getting it. We all could get it. Okay. All right. Y'all understand, now I'm getting pumped. So then there's also one more why early detection matters. It empowers the patient to engage in their care. Now you in the know. Now I know what potassium is, and mine kept being low and stuff. Now I know what the potassium, that little K plus and stuff, all that little fancy medical stuff and everything. Yeah, I know what potassium is. Yes, I also know what magnesium is. Yes, I know what phosphorus is. Yeah, it's on the element table. That's all I know. No, you might know calcium. We always hear bone calcium or something like that and stuff. Well, how about you know what it is and when you need more of it? And if it's low, let's get something in there to get it back up, and stuff. That's where I'm going with this and stuff. Some ways of how to detect signs and symptoms, and then I'm gonna go ahead and leave it alone and everything. And that is self-awareness, knowing your baseline. I know some people that went through life and they never ever got their blood pressure checked. I used to play basketball. I don't need to get my blood pressure checked and stuff. I ain't got no high blood pressure. How you know? Is you in there with your heart? Because this show working hard. It still be beating from the time you was a little baby till now, and stuff. Be nice to it. You only get that one. I mean, they got some transplant. How you know it's going? That's a whole nother animal. But anyway. Regular checkups. Get to the doctor. They always poking on me and stuff and be touching me in the wrong places. No, they touching you in the right place because they might be like, ooh, you got a little rat. You itching. I know you itching. And stuff. Let them see it. Let them see it. Let them see it, Charlene. Let them see it. Okay? And stuff. Also, tracking your symptoms. Journaling. Okay, now you've been found out, okay, I got high blood pressure. Okay, I got diabetes. Now I got me a little machine to check my sugar, or I got me a little blood pressure machine to check my blood pressure and stuff. I noticed that when I do get turned up and I'm ready to knock somebody out, my blood pressure be going up. So I probably need to hostage negotiate my way out of that. And I probably shouldn't knock nobody out because they going to go down and I'm going to go down too. We're going to both get knocked out and stuff, okay? And stuff, or the blood sugar, okay, In the evenings, I probably eat a little too heavy. So I'm gonna start just eating smaller meals throughout the day so that I don't just engorge in food, at nighttime and stuff, or in the evening time, or too late at night and everything. And I'm still hungry, and it's 1 o'clock in the morning. I'm still eating, trying to get me a full steak meal and stuff at 1, 2 o'clock, 3 o'clock in the morning, unless you're on night shift somewhere or something like that. But yeah, not even at that time. Eat it in the daytime where you got a chance of working it off somehow and stuff. And then also, what else did I want to say about that? A lot of red flags of signs and symptoms, because I want to make sure that I'm getting to the good part of that, and that would be red flags. Never sleep on chest pain. If your chest is hurting and you don't know what it is, it could be something like GERD or some acid reflux and stuff like that. But if it's hurting and you really feel it in your chest, and your heart is supposed to be on your left side, it's a couple of anomalies to that, but mainly on your left side. If you feel like you got to clutch your chest or something, there's something wrong and you need to get to the hospital. It's not burning for nothing. It's not stinging or aching or that feeling that you can't catch your breath, or nauseated because it's hurting so bad and stuff. You can't scrunch up for nothing. Not a Tylenol in the world gonna save your life. Welcome on in, Miss Sandra. Yes, all right. And stuff. And Josie, Miss Josie, you said, I always check my blood sugar. I know I have to be on top of it. Absolutely. Because the moment you just slip, because it got back normal a little bit and stuff like that, that's when it go back up on you and stuff. Because the food, we convert as much food, and even when we're eating good, an apple got sugar in it, a banana got sugar in it. So you don't escape sugar and stuff. And then some people need a little bit of sugar because you need energy. So don't try to be Mr. Perfect or Mrs. Perfect, because that's going to get you caught up too, and stuff like that. Just like, oh, I'll never put no salt on my food. Well, congratulations, because you shouldn't, because we get enough food from natural salts inside our foods that we don't need to add an extra lump of salt or lump of Larry's or lump, whatever the seasoning is. I got Larry's in my cabinet, so I'm not gonna lie to you or nothing like that. But I'm just saying that they do have new low sodium things and stuff that you can have, and stuff like that. But yeah, stay on top of it. If you always getting headaches, it wouldn't hurt you to check your blood pressure. Just that. If you find out, I bet you won't have a heart attack, because now you in the know. You see what I'm saying? You don't get to just die from it and drop dead, and stuff. Josie said, so true. Yes, indeed, auntie, that part and stuff. So then sudden confusion. Yes, sudden confusion is not normal. How you going to be all like, I'm on here, and then all of a sudden I'm like, oh God, I don't know what I'm doing. What am I on here for? Yeah, that's not, no. So sudden confusion, that means, where my keys? Yeah, something, maybe you just got stressed out. Maybe you heard some news you didn't want to hear, or something like that. But that's where that comes from and stuff. So just being able to recognize those things, early response is always better. So that's our take-home message. Signs are things that's seen, symptoms is things that's felt. Myths or untruths can delay your care and can actually take your life, just from listening to, oh, it ain't even that true, it ain't even that bad and stuff, and it is that bad. It's whispering, then it's gonna yell, then it's gonna take you on out of here, including me. Okay, and stuff. And then also there's early detection saves lives, and it actually lowers the risk of complications and other things going wrong and other things going wrong and other things going wrong and everything. So that's a big thing. And be proactive. So always be in the know about your health and stuff. Be on a podcast like this one. There's other ones out there, but Nurse Ellen is Nurse Charlene is Nurse Charlene, at the end of the day and everything. So be proactive and listen to your body. It's snitching. I don't care. A hangnail, it's snitching. When that hangnail gets a little bit of pus on it, then it's snitching. Okay. Miss Sandra says, I don't know if the topic is sugar, but my question is, can you check your own sugar to see if you have diabetes? Yes, you can, but you would have to get a actual machine. They sell them at any pharmacy, whatever nearby pharmacy you have to you, CVS's, Walgreens, Walmart, Costco's, any place that has a pharmacy, they should have like blood sugar machines and then the prickers and stuff. And sometimes they'll be nice enough to tell you how it works and everything. So that's the end of the signs and symptoms part. Now the second part is a little important, and I might go over by about maybe 10 minutes, y'all, but bear with me because this is important. And it kind of stair steps off the back of first you checking your signs and symptoms. Now you go into the hospital, and then hey, they find out something is wrong. It's not all well in Kansas, and stuff like that. And then that's when this other stuff come in, and it's called caregiver, the role of the caregiver, and the effects on the mental health. And as I give this to you and stuff, I just want to let you know that I'm currently nurse Charlene. I keep wanting to say nurse Allen. Nurse Charlene wants to give this to you because I'm currently going through it and everything and stuff. Me and my family, and stuff. And we got to figure out what our roles is and what our importance is, and stuff like that. Which is we're all important. The patient as well as each and every family member. Everybody can send that love. Everybody can send well wishes and good vibes and pray and everything and stuff. And that should be always accepted where it can. And if you're not religious, think about it, research it, and stuff. Maybe you might find something that fits your, lifestyle and everything and stuff. But at the same time, everybody's role is important. Nobody's is over the other one, no matter what. Even as one person knows all of this and a slew of this, it doesn't make somebody else's role less important. Everybody has their own blessing, their own gift in it, whether it's just being able to recognize and watch somebody. And I know it ain't right, so it must be wrong, and stuff like that. Some people are more hands-on and can do and stuff like that. Some people are more prayerful and can supply the foods or supply the this and that or something like that. Some people might have the transportation or something like that, and the wherewithal to get resources and different things like that. So then that comes into play and stuff. So these all make sense. Can you clamp it off with that little white clamp right there? Just click it. Yes, and stuff. So the definition of family caregiving, an overview is 1 in 5 adults in the U.S. is a caregiver. 1 in 5 adults. We got millions of people in the United States, and 1 in 5 adults are the caregiver. Okay. Importance of understanding mental health implications. So we're going to talk about that. The importance of the mental health of the caregiver. And I have somebody on the line. Hopefully she'll be able to chime in, Miss Sandra and stuff. I witnessed her taking care of her mother, and everything and stuff like that. And that role of a caregiver and that role of being vigilant, and her not being a nurse, but it ended up being a nurse, when it was all over with, and said and done and everything. She ended up developing those skills to where she knew when this was wrong or that was wrong and what to treat on this and what doctor to call and, and all of that stuff. And all of us should be able to try to horn in that skill, because that's going to be key on everything. Or every time a kid gets sick, because you're a caregiver of a child, and stuff like that. You're the caregiver of your mate, your husband or your wife, and stuff like that. You're the caregiver is, you end up sometimes being it by default. It ain't just because you a nurse that's the only people know, what's going on and stuff. It's sometimes you just get it and stuff, and you have no choice. You don't get a choice in the matter. So that's why this is important that I go over this with you guys. And so responsibility of family caregivers as opposed to a CNA and a RN and all of that stuff, those are all fine and dandy. And usually in the hospital, you get those and stuff, but there's other resources you might be able to get that. But for matter of fact sake, these are families like you and me and stuff, just caring for our loved ones that had a big fall or had a stroke or had a heart attack or had, a diagnosis, unsolicited diagnosis that, they weren't ready for and stuff. That's when you got to kind of jump into action, ready or not. Here it comes and everything. And that would be responsibilities of family caregivers, assisting with daily activities like bathing, meals, and medication. These are just daily activities, dressing them, cleaning their laundry, cleaning their beds, making up their beds, getting them set up in bed for food and lay down for naps and so and such and such. It entails a lot and everything. And then also another role of a family caregiver is coordinated medical care. So now the person is at home and stuff, and so they're doing good and everything's, fine and dandy for now and stuff like that. But being able to have that doctor on call, those nurses on call, hey, a resource, a triage nurse or something like that. Hey, this is happening, blah, 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 and stuff, and being able to, get that information in to somebody and stuff. Those are very important roles, and they make a lot of sense. And you'll find out now because you'll mess around and find out. It's another word, F around and find out, but you're going to mess around and find out and stuff. Yes, Kathy, very true. Firsthand and everything and stuff. Also, a responsibility of a family caregiver. Managing finances. Guess what? They will still cut your PG&E off if you in the hospital and stuff caring for a family member or something like that, and you get home and your lights is out or your water is turned off or your cell phone. They don't care about that. These T-Mobile, AT&T, they don't care about you. You better care about you and be ready to have that mental health where you could break from that and be the whole person that I still got to pay the PG&E and the rent and stuff, or I might come and my couch is out on the street, somewhere or something like that and stuff. So those things, legal affairs, like knowing what's your status. Do you have a do not resuscitate? Are you a full code? I don't know if anybody's ever heard those things, but those things are very important. Do you have a person for your health care to make decisions for you just in case you get incapacitated? These are important. These are life-threatening to you and the person, and stuff like that. They can't check back in because they had to check out because of their diagnosis. So now it's up to you. Squabble up and stuff. So then we got emotional and social support, being able to find a way to cope. If you ineffectively coping and the person is ineffectively coping because they got a new diagnosis of dementia and they don't know what the moon from the sun, and stuff like that. And then you mess up and you stressed out because why they don't know it and stuff. And where did it come from? And stuff. Now you feel like you got it too or something like that and stuff. So you got to be able to check those feelings at the door, and stuff, and still be able to take care of them. Because sometimes they might see it and see you stressing and be like, oh gosh, and stuff like that. So you got to be able to check them feelings and stand up, grow up. It doesn't matter if it's a woman. It doesn't matter if it's a man, and stuff like that. You got to be able to stand up. If it's a man, that's your wife, that's your children, and stuff that could, and stuff. If it's a woman, that's your husband, that's your children, and stuff like that. That's your family, that's your mother, your father and stuff. Come on now and stuff. And then also the role and responsibilities of a caregiver is often unpaid. Some, there got resources now where you can get paid for some of it, but often underpaid for what you do in life and stuff, but also not enough. If you're doing 24 hours, I don't know anybody yet that found a 24-hour payment plan. unless you're in the hospital and you're a nurse and stuff. And if I work 3 shifts, I ain't working on 3 shifts, but I mean, I can get 24-hour money, and stuff. Yeah, no. Okay. So then also there's the mental health challenges of the caregiver. So it's already enough on the actual patient that's going through it, whatever it may be. It doesn't matter. They're going through it and stuff. So the caregiver, that next in line or the next couple in line and stuff, they got to deal with the mental challenges of this. Now this person is not like this. They a little different, or they a lot different, and stuff, depending on what it is and stuff. Then it's time to step up. But sometimes you ain't ready. I wasn't ready yet. And stuff like that. I'm just saying. So then guess what happens? You get anxiety. You know what anxiety? Oh, I'm so stressed out. I got to do this, and then I got to go down there and make arrangements for the PG&E. I got to. They cut off our phones. Now I got to get the phones cut back on and stuff. The doctor is calling me. Okay. If you didn't feel that, I don't know what's wrong with you. I felt that, and shoot, I got stressed. I got stressed out just doing that. But I'm saying that's reality of the caregiver and stuff. Depression. Nobody understand me. Nobody see what I'm really feeling inside. Oh my gosh. And everybody, they come and tell me more stuff, and instead of, do they understand what I'm going through? Okay, I just won't say nothing. And then the care goes down for the person you're caring for, your loved one that you love so much, because woe is me. I feel depressed. I feel like I got it too. Come on, y'all. You feel me? You feel me? Okay. Sleep disturbances. I can't get no sleep and stuff. I'm sleepy and I can't get no sleep because I got to do this and I got to do that and I got to do this. And I woke up at this time and this time and this time, and I didn't get no sleep during the night and stuff. I didn't get no sleep during the day. And Sandra, she said, been there for years. Exactly. I'm glad you let me use you as an example, of taking care of moms and everything and stuff, and how you didn't get no lesson. You just was thrown in and you had to do what you had to do. You knew the basic stuff that you were supposed to do, but it's a whole nother animal, huh, Sandra? Okay. And stuff. So then there's sleep disturbances. So you get insomnia where you can't sleep because you're all stressed out, so you can't even sleep. And then when you finally fall asleep, you sleep so hard that you can't even wake up to take care of the person because you're so tired and exhausted mentally, physically, and everything else and stuff. Come on, y'all. I'm talking about some real life stuff going on here. Okay. Burnout. I'm just done. I don't want to do nothing. I don't care no more. I care, but I don't care, and come on, y'all. Wow. And stuff. This is really happening to everybody. You don't get a choice of which family member go down. They just go down. You better hope you close enough to tell them to snitch so that it won't be so bad when they go down. They can recover and then they can take care of you for a little while and repay the favor. Okay. Some triggers. The triggers of why you even feel depressed, or you can't sleep, or you can't eat, or you get depressed, and feel like, oh, woe is me, and all of that stuff, is triggers. Constant stress. Everything. The Army, the Navy, the Marines, the Air Force is calling me. Everybody calling me PT, OT, this and that. Oh, I gotta play this role. Oh, the doctors tell me this, that, this and that. If y'all don't know, I'm a human being. Sandra's a human being. Kathy's a human being. Josie's a human being. Brittany's a human being. Rosie Granny Allen is a human being. Mike Jr. is a human being. And everybody else on there, Michelle Farrah's a human being. Michelle, I know that I know and stuff if you still on. But I'm just saying. and stuff. Guilt or grief. Why didn't I catch it before? I'm a whole nurse. Why didn't I catch that? Why didn't I see this coming? Why didn't I see? You got an x-ray and a CT scan in your brain? You didn't see it coming on you either, huh? Because you're so busy looking at somebody else, you didn't even look at you to see if you needed an x-ray or a CT scan. So you put your stuff off. Okay, I'm going to get there. Isolation. Nobody helping me, so I guess I'll just be on my own. Okay. Because sometimes visits just won't do. I actually need somebody to go ahead and get in there and watch. Get in there and keep an eye out on this or an eye out on that. Go ahead and go pay my PG&E. Here go my card. And you know what I'm saying? Sometimes the visit, that's nice and all, but sometimes the visit need to turn into something. Can I do something? Can I take out the trash? Look at it. It's just piling up. I'm just saying. Come on, this is reality. I know y'all know this is good. I know you do. And stuff. Come on, let's go. And stuff. Fitting in with social identity and stuff like that. So the caregiver, we talking about the caregiver tonight, not the patient, the caregiver, whatever role that is. Remember, we all got family ones, loved ones. Hey. Sandra says, say it again, Charlene. That part. Yes. Pump me up. Go on, girl. That's help and stuff. I feel my help coming and stuff. So then we got role strain. The caregiver versus the professional or the personal roles and stuff. It's like I'm the caregiver, but I'm also the nurse. So currently, if nobody knows and stuff, I've said it before and stuff that I got 21 years in nursing and stuff. So I posted recently on my Facebook page, the doctor was like, if you want your mother to come home and stuff, you need to do her IV therapy. And then I put down the hospitalist said that to me. And I was like, oh, you thought I was scared? No, I'm a real nurse. I'm a real nurse, an active duty nurse. So guess what? I'm infusing IV antibiotics. Boom. Okay. I'm just saying. Don't talk about it, be about it sometime. Okay. All right. So then the social withdrawal, feeling funny, time constraints. I can't go to that party. I ain't going to that birthday party. I ain't going over there and stuff. And I can't do that. I mean, do they understand? They going to have a birthday and I'm in the hospital going back and forth. Come on. I'm not going to personally, that's not me, but I'm just saying it makes you feel funny because you can't celebrate this or celebrate that because you celebrating each day that person lives, and stuff like that. So sometimes you just gotta be able to say, hey, I gotta sit my little tail right here and proceed as I can. I will try to get out when I can, but I got to make sure I get to the good part first, and stuff. And so forgive me, Pastor Mayfield. I did get a chance to watch you online preaching and everything and stuff. And it was wonderful. And I had everybody in the house watching and stuff. But at the same time, I got to squabble up and everything. So I know already what I'm going through and stuff. But you did good. Job well done and stuff. Then we got a lot of, this is for the caregiver, cognitive symptoms, forgetfulness, difficulty concentrating. I went in the living room and stuff. My mom wanted a cold towel for her head and stuff. That's something simple, right? But I was already in there washing dishes, so the dishwasher water got cold, and I was in there, trying to do that part and stuff. Thank you, Pastor Carol, and stuff. She said thank you and stuff. Yes, I acknowledge you. Yes, and stuff. But also, and stuff. Then I go in there and start washing dishes, and I forgot that I was supposed to get a towel. And then I go in the back and start making up the bed and stuff, and I forgot I was supposed to go to use the bathroom. Now I'm rocking down the hallway, dancing down the hallway. You see how easy it is? If you don't know, You've been across it sometime in the past and everything, but that's where difficulty concentrate and stuff. Now I gotta sit down and then I gotta talk about this, blah 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 blah, blah and then I gotta woo woo. Okay. And stuff. Behavioral changes, withdrawal, neglecting yourself. Oh, who was that? Oh, that's me. I didn't put no deodorant. Remember, your body is a snitch. If you must see, you must see and stuff. So I'm saying all that to say that that's not my normal repertoire. You know, I got my Dolce and Gabbana, I got my Versace, I got my, you know, I got my little perfumes and everything. I bet you I didn't think about spraying not one of them and stuff. But yeah, I need to remember deodorant. Amen. Okay. And stuff. Wash your face, brush your teeth, and guess what? It might be cool because I lost a few pounds and stuff, but eat. You can't be going without no food and stuff, and not fast. You got to eat when it's time to eat. God didn't say you got to fast every single day forever and ever. You won't live, and stuff. You got to eat something and stuff. So don't forget to eat. If you feed them, feed you too and stuff. So I'm just saying that and stuff. Another thing that goes along with caregiving and mental health and everything is strained relationships. Like if you're taking care of your mother and you're married and you neglecting your husband and your kids and stuff because you're doing all in on that, or you taking care of your wife and you neglecting the kids and your parents and stuff like that and her parents and stuff like that, however that family dynamic, it gets rough. There's a role reversal that happens with caregiving. Sometimes the child is now caring for the parent, period. It doesn't matter which parent. The child is now caring for the parent. So that gets a little weird. Like my mom always took my temperature and made sure I was okay. What happens when my mama is not okay and I need to take her temperature and take her blood pressure and check her stuff out, and everything, things she can't do for herself, or things my father, can't do for herself right now and stuff. So there's the role reversal and stuff. Also, there's also roles of sibling conflict over caregiving duties. Like which one feels like they're important. You're all important. Everybody is important. Every single person is a part of this intricate team of love and caring and love and kindness. And we all got to find our roles and fit into them. One shouldn't be stingy and stuff. I know it all. I can't do it all. I'm going to go crazy and stuff. So I got to make sure that I let everybody know that everything is welcome, that you are welcome, that you are a blessing, and stuff, so that it doesn't get misconstrued or the anxiety doesn't go to the wrong place. Because I'm proud of me and my sister. We teamed up inside the hospital and we was scrubbing and dubbing and scrubbing. They loved us there, and stuff like that, because that's what we had to do. We had to put down everything else and let's go. Because we know what our mother would like, and stuff like that. And guess what? It made her healthier. It made her recover faster. And she's at home. That's all that matters and stuff. So when I'm telling you this stuff, I'm telling you out of actual experience, making me an expert because I'm going through it. Okay. But not just me. So I said I'm going through because I'm doing the podcast and everything and stuff. But I'm saying making that role for my family to know what should they do, when should they send their love and kindness, when should they show up and everything, and stuff like that. This is what everybody, because it will touch each and every one of us whether we're ready or not. Yes, Pastor Mayfield, she said thank you. Absolutely, because we're going to come across it. But what if you ready? You're not ever going to be ready, but what if you ready a little bit, enough to get through and everything? It changes everything and stuff. So I'm actually coming to the conclusion, but you see how special that is, and stuff, getting beds and doing this and everything and stuff. You just can't put your your life on hold and stuff, and I wrote down a couple of notes that I wanted to say, and it's just simple little things. Your headache ain't headaking for nothing. Just remember, check yourself, and stuff. And early detection, meaning if you've always had a headache no matter what and stuff, that's probably because you had something. You might have had a brain tumor, you might have had something going on or something like that. But that's the only way you should always have a headache, where it's just natural to have one or something, because you have a certain thing. But if you've hardly ever have headaches or nothing, unless you stressed out or something like that and everything, and then this happens, you better pay attention. Something is happening. Your body is saying something. And then I wanted to say this thing. I said it over and over and over on Your Body's a Snitch, Believe It, that topic last week and stuff. And it says, symptoms are your body's way of yelling when you refuse to listen to its whispers. First, it'll whisper. It'll be a light whisper. You take that Tylenol, you get rid of the headache. And then you get another one. You take that Tylenol, you get rid of the headache. And then you get another one. And now it's a part of your everyday life to just wake up, take you some vitamins, and take you some Tylenol and everything. So you keep ignoring it, right? Now you got full-fledged, not borderline blood pressure. You got full-fledged blood pressure problems. Because I'm healthy. I'll be getting out, I work and stuff. So I'll be running up and down the stairs at work and stuff like that. So you can still get it. Your body was telling you was going to ignore it, huh? Oh, yes, Kathy. She said, go get checked out. Yes, go get checked out. Let them take some blood if that's what it needs to happen and everything. Brittany said she was so cute. Who was so cute? Me? All right. Look, thank you. If you was talking about me, or maybe you. Okay, you cute too and stuff. The other one is that backache is not just hurting for nothing. Say you got a strenuous job and you pulling up patients or something like that, or you construction, you lifting them heavy materials, bricks and whatever equipment, and walking up them big old long ladders and all of that stuff, or twisting this way or twisting that way and hurting yourself and everything and stuff. Those all make sense now when you say your back ain't backing out for nothing, and stuff like that. I found out that there's no back transplants. So you don't get a new back when you blow out your big back. You blow out your back, and stuff like that. So guess what? What happens when you mess up your spine and all of that stuff, and you got to get fusions, and now you're in a wheelchair for the rest of your life because you ignored the whispers, and then it started yelling, and now you're crippled for life, for the rest of your life. And you got to go on disability, and then that's a whole nother animal and physical therapy, but you can never walk again because you ignored that back pain. You took that Tylenol one too many times and never, ever got an x-ray, never, ever got an MRI. You hurt your knee and stuff, and you still walking on it. It'd be okay sometimes, only when the cold and stuff. And then now, boom. Now you crippled and you got to get a knee replacement, and then it didn't turn out right or something. I had another nurse friend of mine tell me that she got the knee replacement and they broke her bone while she was under sedation. So then she had to recover from a broken bone that wasn't supposed to happen and knee replacement. So now they got to go back in again because when they broke her bone, they messed up her whole knee and stuff like that. Now she's going to have a whole array of problems. And yes, she's medically inclined and she know medical stuff and she know what's wrong for her and she know what's set up for her. That's got to be the most stressful thing in the world. So when I'm saying all of that, when I give you all these subjects and signs and symptoms and stuff, I'm giving them in love because I want you to start helping yourself get to the good side, helping your family members, catching those symptoms. And telling them, you know what, they don't have to come on. Just you're good enough. You're enough, and stuff like that. But if you could get them on, if they need to see a physical person in face. I'm sacrificing myself. I'm putting myself out there. This is me, and stuff like that. And I'm doing that because you're going to call me anyway, anybody that know me. but also to get it out there to other people that don't know nothing about me, and tell you you can actually figure this out and stuff. And your body is a snitch, believe it. That's really the truth. It's telling, it's a tattletale, because it's in your body, knows your body more than you do. So it knows when that vein is getting stopped up. It knows when that artery is getting clogged. It knows when those lungs aren't working properly, and effectively. It knows when there is too much glucose in the system. It knows when there's too much pressure on the heart from high blood pressure. It knows when you got heart disease and stuff. Why aren't you believing it? It's in there, like, oh, look at this, oh, and stuff, it's crazy. And Josie said, sometimes the doctors don't listen to what the patient is saying. Absolutely. You gotta make them listen. Make them listen. Diagnose yourself. I've been on Google, and it said that you need to get me one of them blood tests and stuff, so that we could see if my troponin levels and my heart attack levels is within normal and stuff like that. Because all it takes is one test. But guess why they'll blame you? Now, Josie, you said sometimes the doctors don't listen. Guess what they say? Sometimes the patient don't understand what I'm saying. They act like they don't hear me and stuff like that. They not giving me the information, like their father had high blood pressure, or their grandmother and grandfather both had high blood pressure. They not telling me no history. So what, I'm supposed to guess what's in there, what's on them? They not my family member. I don't know them, and stuff like that. So they gonna blame you, and you gonna blame them, and then guess what? Y'all both get to go to sleep forever. See, and stuff. So make them understand. On everything I love, make them understand. Say, you know what? Since you don't seem to be, I heard this word, my sister gave it, culturally sensitive, and you can't understand me because I'm like, yo, my pressure. I heard something about my pressure, my heartbeat beating out my chest, and you talking in layman's terms, which is what my podcast is, medical talk in layman's terms. When they don't hear you, you go be heard by somebody else, because you got the right to change your doctor. Just make sure it's in the network for your insurance and everything and stuff. Go to another one. That one don't want to listen. Go to another one. But remember, you only get one of you. And when you go, nobody get to be you. Nobody get to play the role. The grandmother, the grandfather, the father, the mother, the uncle, the brother, the auntie, the sister, and stuff like that. Nobody else get to play you. So at the end of the day, be mindful. And when people are going through it, anybody out there and stuff, you see people going through it, including me, a lot of people know me, and stuff like that. When we're going through it and stuff, be mindful of that. It's not about you. It's not even about them. It's about the patient or whoever it is. It could be anybody. It could be somebody's little baby. It could be somebody's teenage child, or young adult child and stuff like that. So at the end of the day, when people are going through this, sometimes they're not ignoring you. They just been on the phone all day and all night and haven't gotten no sleep and stuff like that. So remember, when you see that caregiver, be careful with their feelings. They're already in a mental health crisis by default. So be careful with their feelings. They're tired. They're overworked. They're underwhelmed, and stuff like that. They're going through it, and they're just trying to get some decency, some stability, some love in their life and everything and stuff. This is important. Please, if you don't listen to another podcast, listen to this one. And what I'm saying and stuff, it all makes sense. It doesn't matter if you're the doctor. I could be the doctor, the physician. I could be the nurse. I could be whatever I want to be. I could be the lawyer. I could be whatever and stuff. Everybody has a little something that they can bring to the table and stuff. And just remember, it's not about you and stuff. So when you're making those phone calls, sometimes they might be talking to a doctor. Sometimes they might be trying to get some sleep because they didn't get none all night long. You didn't call all night long, and stuff. So you don't know that they missed their sleep. They didn't eat. They got headaches, hunger headaches, and all of this stuff. So when you get all of that in, and you take all this stuff I'm saying in and stuff, then you'll understand the role of the caregiver. You're the martyr. You're important. You're very important. You're absolutely presidential important and stuff. And it's not about nobody else's feelings but yours and that person you're taking care of. And if they don't have the wherewithal to even have feelings, um, that might be good for them, because if they actually are in their right mind and then they see their caregiver going through it and stuff like that, that's a cold-blooded thing. And then it depresses the actual patient and hinders their recovery. So I hope I did you guys justice. This was from the heart this time. This was from the heart. And I know that I've saved somebody's life just from tonight alone and everything. Y'all look out for each other. Y'all be careful. And sometimes if you don't hear from them, pray for them and everything. Oh yes, Josie got one more. So while it's on here and stuff, I'm gonna go ahead and answer it and stuff, or at least try and everything. And look out for your comments. Anybody that said something and I might not have seen it or something like that as I'm talking and reading and everything and stuff, I will go back in the comments after the live is over and answer your questions or give you a comment on the comment and everything and stuff. I see you and I thank you, all the participators and everything. But Josie said, I told my doctor my feet was a little tingling, and she said, okay. Then she left the room, and the nurse came in and told me she's in the room with someone else. So I was going to get another doctor because she didn't. Anytime they're in there, because they collected that money, they collected that $150 an hour, that $200 appointment and stuff. If they walk into another room because they're behind, because their job is scheduling them too many people back to back, and if you got a 30-minute appointment and somebody else got a 30-minute appointment, y'all scheduled at the same time with the same doctor, the doctor's office is failing you and the doctor, because they ran into that other person's room and stuff and left you and stuff. I had the hospitalists do that to me, and I'm a nurse and stuff. And they said, okay, you asked me too many questions and stuff. And now, I got other people to see. Do you think I care about those other people? That's my mama. Y'all with me? All right. Kathy said, pray for them all the time. Absolutely. But Josie, in your case, I really want to, Auntie, in your case, I really want to say that happened again, and you better absolutely change your doctor's office, not just the doctor. That means the whole office is dysfunctional like that. And they don't need to get your money. Let them get the other person's money that they running into that room, because it might be a little bit easier than you, and you got the nerve to tell on it. And they don't listen. And I'm telling you to tell on it. Oh, yeah, that's a disservice. That's malpractice. That's malpractice. Thank you, Sandra. She said, good podcast. See you next week. Amen, sister. Yes. So I'm about to get on off. I stayed on a little while longer because this type of stuff that I see on here, that means you are paying attention and you are tuned in and everything. And I thank you, each and every one of your comments, each and every one of your questions. And I will be answering them after the live is over and everything. But I thank you all for coming in. I thank you all for your support, and I appreciate you. And this is another. See, I just got some more information because I got some of the most dynamic people on this podcast, and they are not coming here to play. They're not coming here. This is not just an ordinary podcast. It's been already sanctioned by God to be better than better and everything. Better than good, like Pastor Romero Weston would say to me, better than good to me and stuff. And she said, complain to the California Medical Board. When they start double booking your doctor and you got a 40-minute doctor's appointment and they didn't ran out and ran into somebody else's room and started taking care of them. And I bet you they didn't wash their hands. But anyway, at the end of the day and stuff, they are committing malpractice. They are not giving you your 50 feet and your space to get your stuff done, or your comfort to be able to talk to them. And that's another reason why people don't go see the doctor and they go see a podcast instead. And I tell you, you got to reach out to your doctor, But if your doctor is failing you, then you make sure that money is failing them and take it away and put it in somebody's hand that's going to sit there and talk to you and be culturally sensitive to you, if that makes sense. I thank you guys. Bless each and every one of you. And I hope if you're going through anything like I'm going through, but in your particular situation, that you know, be strong. You gonna get through it. He don't bring you through nothing unless he gonna bring you through it. He ain't gonna bring you to it to not bring you through it. So he's gonna give you that extra strength when you thought you didn't have nothing else. I thought I was gonna be able to come on tonight because I was tired and everything and stuff, but I got me a good sweet rest in, and I was able to come on all fresh, not bags and stuff, not musty and stuff, and take care of you guys and stuff. I look forward to seeing you again next Tuesday, and I'll keep you in tune with me and my situation and my family member, because I too get to go through it just like you. I'm not special. I'm not just a nurse. I'm a patient. I'm not just a nurse. I'm a daughter. I'm not just a nurse. I'm a sister, a auntie, a grandma, and everything else, just like everybody else and stuff. And it doesn't matter and stuff. Everybody's important, and everybody's role is very vital. Take care, you guys. Okay. All right. Yeah.